The holidays are just around the corner, but Omicron has the potential to change things in a pretty big way, especially when it comes to holiday plans. So let's try to understand where we're at exactly with infectious diseases specialist Dr. Susy Hota in Toronto and Dr. Lisa Barrett in Halifax. Hello to the both of you. Dr. Hota, I'm going to start with you. We know Omicron has the capacity to spread very quickly, right? Its mutations hint at that possibility. So does its doubling rate in different parts of the world. So in Canada, do we believe this will become the dominant strain?
It is certainly very possible. I mean, if you look at what's happened in the Gauteng province of South Africa, the doubling time is 2 to 3 days. It's risen exponentially in that population. But there are a few caveats to that. For example, we've just kind of learned more recently in a study that people can get reinfected with this variant more easily than with other variants. And so at least some of that rise might actually reflect reinfections on top of potentially some increased transmissibility. So I think we need to wait and see what plays out in other jurisdictions, including here in Canada, and look at what that secondary attack rate is in households where people have been in contact with cases or in workplaces and other settings, and get a better sense of what that transmissibility risk is and how it interacts with Delta, because Delta levels were kind of low in South Africa at the time that Omicron took off. So I think it's important to see what happens here.
Before we get to the question of reinfection, which I think is a pretty important one, Dr. Barrett, can I ask you just about, at a basic level, Omicron's severity? Because the initial kind of anecdotal evidence from frontline doctors in South Africa was that the symptoms seemed milder than Delta, and we are about 2 weeks out, right, from the initial discovery. Is there good reason to believe that Omicron is milder than Delta?
Yeah, it's a great question, and we're really going to have to work on figuring this out, because we don't want to jump to conclusions, and this is a very important part of what we're doing. So the first part to answer your question is, number one, we really have seen from the data that's come out in South Africa that it does appear to be some younger folks who are getting infected or reinfected, to Dr. Hota's point. And those folks seem to be having a somewhat milder set of symptoms. However, we also don't really know if those folks have been re-exposed, how many of them have been re-exposed in the past. And the keen part here is that, as mentioned previously, Delta wasn't around as much. And did that create a different environment? So early suggestion that perhaps this is milder, but I certainly wouldn't say that we should extrapolate that to being an Omicron characteristic yet. We really do need to presume that there will be at least as much severity for the moment, but hopeful that maybe it may be at least just about the same or a little less.
Dr. Barrett, when it comes to Omicron's ability to reinfect people who've already been sick from COVID, what is the big picture consequence of that? Because I suspect that will matter particularly to those people who may believe that they have immunity because they've been sick prior, compared to those who have immunity because they've been vaccinated.
Yeah, we definitely want folks to recognize and know that if you've had what we call natural infection, or you've been exposed, had the disease, and have recovered, that you are not protected from this particular variant. And while that may be true for Delta in certain cases, we know that right now vaccine is still your best bet in terms of not getting sick and not having a poor outcome when it comes to COVID, period. And that's likely to be at least the case, if not more, with Omicron. Although we are still, and I will say this a lot, we are still gaining a lot more information at the moment. So be prepared for things to change as we go along.
Okay, so point taken. In the even shorter term, because I know a lot of people are thinking about the holidays, this is probably the number one question we continue to get. Should I cancel my plane ticket? Should I cancel my train ticket? Should I cancel my large family gathering or even my small family gathering? Dr. Hota, what would you say to that person if they need to make such a decision sooner rather than later?
Yeah, I mean, I think in terms of gatherings, we're not at a point where I feel like we have to cancel all gatherings, but we should be mindful of the size of the gatherings. And, some of this is because we're still facing Delta rises And we haven't even considered what it's going to look like with Omicron in the picture as well. And so I do think we need to think about smaller numbers of contacts in order to get through the next several months. And also be very prudent in terms of the environment where you're going to get together with people. So consider some outdoor gatherings along with indoor. What's the ventilation going to be like? Keep a window open, no vaccination statuses, get the third doses or boosters if you're eligible to get one prior to these gatherings. Let's try to mitigate the risk as much as possible going into the holidays. Travel's a bit more tricky. I think it's very difficult for a lot of people to change their plans at this point. And so again, it's about risk mitigation, knowing the environment you're going into and deciding what's happening in that country or that area, getting travel insurance, being prepared for changes that might happen really quickly, and the possibility of having to quarantine when you come back.
And Dr. Barrett, I want to ask you the same question. I mean, ideally, we could just all take a wait and see approach until we have more information. But if you had to give someone guidance right now, what would it be?
Yeah, the wait and see plan with COVID is exactly what we've learned we really shouldn't do. We don't have to lock down, but I think it's exceptionally important to think about what you're doing. Take a moderate approach. You don't have to do all the gatherings all the time with all the people. Some gatherings, some of the time with some of the people. And really, if you have access to some additional layers of protection, including that booster or third dose, and also some testing, make use of all the tools in your toolbox. Stay home if you're sick, and really encourage your friends and families to make sure that they're all vaccinated when they get together.
Good advice, good information, as always. Dr. Barrett, Dr. Hota, we'll have to have this conversation again soon. Thank you.
Thank you.